Thank you very much. My name is Michael Stewart. Thank you, Chair Dembro, Vice Chair Weber, and members of the committee for hearing us today. As I said, my name is Michael Stewart. I have worked as a medical assistant for 27 years, 19 of those years at OHSU in internal medicine, and I live in Vancouver, Washington. As a medical assistant, we help in the clinic, we help calm nervous patients. I'm a little nervous myself today. And help folks that they're somewhat angry, nervous coming in, relax before they see the doctor, their provider. We check your vital signs, we give you immunizations, EKGs, pregnancy tests, along with several other direct patient care needs that the provider orders during an office visit. We also answer patient messages, provide process refills, call patients, and enter patient information. We have a role in nearly every aspect of ambulatory patient care, and as such, we are a vital bridge between patients and their providers. We love our jobs because we love to help people in need. And I am here today to speak in favor of Senate Bill 423 and 273. It is common practice for public universities who receive state funds to have built-in designated seats for key stakeholders on their board of directors. Counter to what they may tell you, OHSU is a public university as it receives nearly $40 million annually from the state of Oregon. They will tell you there are already seats on the board that represent the stakeholders in this bill, but they are not codified in any way so they can change them at any time, and they have. As with the recent removal of Stacey Chamberlain from the board. Additionally, there is no transparency in how the board seats are designated and the changes are made, or how the changes are made and who makes them. The board makes decisions about staffing, budgets, and hiring practices that directly affect people like me, my coworkers, and the patients we serve. Yet we have no voice, no ability to influence those decisions. The negative impacts of this situation and the lack of our voice on that board was obvious during the recent pandemic and the ongoing pandemic, as we witnessed major staffing shortages, many driven by short-sighted budgetary decisions made prior to the outbreak of COVID. You have all heard the stories of healthcare workers burned out due to these staffing shortages. Those of us in the front line, we lived it. It seems many decision makers on the board did not learn any lessons from that situation and from those stories of burnout. The most recent budget plan presented by the CFO and passed by the board in the name of constant expansion and growth greatly increases patient volume. It does hire more providers and nurses, but decreases and at times outright freezes the hiring of support staff like me and many others who are vital to quality patient care. My clinic recently hired 8 more providers to an already overstretched clinic without adding a single support staff employee. My manager even has to justify the need to hire a replacement for medical assistants who leave our clinic for other employment, much less add one. This has resulted in medical assistants rooming for 2, 3, and at times 4 providers at one time. This is not good medical care. It leads to burnout and poor care for the patients who come to our clinic. The decisions of the OHSU Board of Directors directly affects people like me and my coworkers, people who have dedicated our lives to healing and serving our patients. We learned the lessons of the pandemic because we lived them. Workers' voices are the voice of reason for ourselves and our patients in the face of unreasonable expectations in the name of the bottom line and constant expansion and growth to gain market share. OHSU should welcome workers' voices and the lessons we have learned, the wealth of knowledge gained by years of service to our patients, our coworkers, and this institution. Those voices and the information, those voices bring with them, yet they continue to stand in the way. And therefore, it is time to bring OHSU into alignment with every other public university and codify these board positions. We work in healthcare because we love helping and healing and serving our patients. We are asking you to pass Senate Bill 423 and 273 so we can have a voice in how we do the work we love. We thank you for your time and attention to this issue.
Good afternoon, Chair Dembro, Vice Chair Weber, and members of the committee. My name is Claire Irvan. I have been employed at OHSU for over 21 years, and I currently reside in Portland. I am the financial coordinator for the Adult and Pediatric Bone Marrow Transplant and CAR-T program at OHSU. OHSU is the only facility in the state of Oregon that offers bone marrow transplant and CAR-T to pediatric patients, and it is the only facility in the state that has a robust CAR-T program for adults. My role is responsible for establishing global case rates for transplant, helping secure single case agreements for CAR-T, and ensuring that services have been authorized by the insurance companies for these $1 million and sometimes $1 million plus procedures. I am here today to testify in support of Senate Bill 432, which would add 3 seats to OHSU's Board of Directors, including a non-faculty seat. OHSU has long been considered a beating heart, OHSU has long been considered a part of the beating heart of Oregon. With that, the OHSU community, which includes staff, are at the center of Oregon's workforce. We are a large, non-homogeneous group of individuals, many of whom have grown with OHSU over the past few decades. We have thoughts, we have ideas, and we have perspective to lend to OHSU's highest leading body. I ask, where is the representation? It's important to understand and worth noting that numerous employees spend their entire career at OHSU. With unwavering dedication, they serve OHSU's community, which spans beyond the state of Oregon, day in and day out. During this time, they gain valuable knowledge and understanding not only of the workings of the university, but also what is actually happening on the ground with fellow employees. When it comes to the board, I ask, where is the representation? In 2022, OHSU announced its 30-30-30 plan to help the state address the current healthcare workforce shortage and healthcare inequities that were magnified by COVID-19 and its inordinate impact on underserved communities. Oregon House Bill 5202 includes a $45 million prioritized investment towards this plan. Undoubtedly, the 30-30-30 plan will impact all OHSU workers. I ask, when this plan was being developed, where was the representation? As my colleague and coworker Michael Stewart stated, it is common practice for public universities who receive state funds to have built-in representation of key campus stakeholders. Including a seat for non-faculty staff will begin to mitigate the disconnect that currently exists between the OHSU Board of Directors and OHSU's workforce. It would create space for representation. Everyday taxpayers deserve to have their voices heard. Everyday taxpayers are the body of OHSU community. Everyday taxpayers have the right for equal representation. My name is Claire Irvan. I am a proud OHSU employee. I work for patients who are waging a war against cancer, and I urge you to vote yes on Senate Bill 423. Thank you for your time.
Chair Dembro, Vice Chair Weber, and members of the committee. My name is Sergio Asena. I'm a project coordinator under the Office of the Provost at OHSU, and I've worked there for 7 years. I'm also a resident of Portland. My team tracks faculty appointments, updates the faculty permanent files, and oversees the promotion and tenure process for all the faculty at OHSU. I'm here to testify in support of SB 423, which would codify adding 3 representatives to the OHSU board, including a non-faculty staff. While OHSU benefits from the nearly $40 million from the state annually, unlike other universities that receive public funding, there is no built-in representation for important stakeholders. This oversight creates a division between those who make the decisions on the future of the institution and those who carry out the day-to-day work of educating students, conducting research, and caring for patients. Currently, the only OHSU employee on the board is President Jacobs. Voices like mine are not at the table. Employees have no meaningful input into the group that makes decisions that affect our livelihoods. And while many staff at OHSU have union representation, collective bargaining is not a replacement for a system of shared governance, especially while significant stakeholders, such as faculty, do not have those avenues. While there is no reason that OHSU should not be governed like the rest of the universities in Oregon. While OHSU holds a public-private status, it's still subject to all the regulations other universities in Oregon and across the country are subject to. If other institutions in Oregon have made having staff and students on the board work, then so can OHSU. Decisions about the long-term future of OHSU need to be made with those who will be most affected by them at the table. The board looks at OHSU from a bird's eye view, but staff and students have a ground level view. We see beyond the numbers. The more that OHSU staff and students are able to participate in decision-making of the institution, the more personally invested they are in its success. And the more successful the institution will be. Codifying these seats will only strengthen us. OHSU is committed not only to ensuring the well-being of Oregonians right now, but also to the well-being of them in the future. SB 423 will strengthen that commitment to our patients, to our students, and to our staff for years to come. So I ask you to vote yes on SB 423. Thank you.